Hi, we're going to now discuss obstetric and gynecologic ultrasound. Specifically, this is a very brief introduction to why you should do it, when it's useful, what the indications are, what the limitations are of point-of-care bedside ultrasound for OB-GYN purposes, and finally, what things you might find, but would usually require a more comprehensive study. So let's get started. Your clinical questions are the first thing we should discuss. So when you're thinking about what your clinical questions are, you're first going to break it up based on whether the patient is pregnant or not, right? If the patient is pregnant, one of your clinical questions will be, and the primary clinical question honestly will be, if there is or is not an IUP, an intrauterine pregnancy. The hope is that every single patient you see will have an intrauterine pregnancy. The bias that I walk into to see any patient is going to be to assume that it is the opposite, right? Like in any research, you assume the null and prove otherwise. So I'm assuming that there is not an intrauterine pregnancy, and my job is to either prove that there is one, and in the setting of a patient with low likelihood of a heterotopic pregnancy, we can stop there. And if the patient is at high likelihood of heterotopic pregnancy, then they need much closer monitoring anyways. And if you don't see an intrauterine pregnancy, or if the patient's at high risk, then you need to think about whether there is potentially an abnormal pregnancy, ectopics, molars, etc. If ever you see a situation when you're not convinced that a pregnancy is a clear intrauterine pregnancy, you can call it a pregnancy of unknown location and go from there. If you have a patient with a negative pregnancy test, one of your clinical questions would be to look for obvious evidence of torsion. Now, ultrasound in general is limited when you look for torsion anyways. The sensitivity of the test is somewhere around 70 to 80%, especially once you factor in intermittent torsion as a disease process. But if you have a patient for whom you're concerned they have torsion, doing a quick bedside study, and then if you see something, getting your OB-GYN colleagues involved earlier can be a very helpful process. It doesn't negate the need for there to be input from the radiology team anyways, but it is a thing that is helpful frequently. And then finally, if you have a sick appearing patient, it can be very helpful to do a quick bedside ultrasound for a young woman of childbearing age to make sure that she does not have if she's pregnant, to see whether or not there is free fluid in the belly based on that FOST exam that we talked about elsewhere. And at the same time, if they're not pregnant, to think about whether potentially there's a ruptured hemorrhagic cyst, which can make people pretty sick as well. There's a number of other pathologies that can present, but that's another way of thinking through that. So let's talk basic anatomy. So as a reminder, basic female reproductive anatomy involves ovaries on either side, fallopian tubes that go over and allow the mature follicle to come into the uterus itself. The uterus heads down to the cervix, and then the cervix is the gatekeeper between that and the vagina. So one of the things you'll want to think about is when you're putting a curvilinear probe and doing an exterior ultrasound on a patient, you can do it in short axis with a probe like this. And what that would do is it would basically give you this cross-section in this plane. And you'd get to see essentially the view from the cervix all the way up to the fundus of the uterus. This is what that ultrasound image can look like in a pregnant patient in particular. So you're seeing skin and subcutaneous tissue up top. There's musculature. Now right here, you see this well-demarcated looking structure with a different echo texture compared to the structures around it. This sort of uniformly echogenic thing in the middle is the uterus itself. You can tell that this is uterus, but right here, this slightly hyperechoic area, that's the endometrium itself. And then right in here is your gestational sac, that first outer bright white line. And then in the middle is what looks like a fetus. Now, in your initial looks at this, as a reminder, the general concept of ultrasound is you don't want to miss the forest for the trees. Look at the entire structure first, and then come back and focus in on what you're thinking of. Now, if you were to look in the other plane, right, and now bear in mind that this is rotating your orientation of the patient 90 degrees and looking from anterior to posterior instead of from left to right, you'd end up seeing this sort of anatomic approach where you're seeing here you're looking here and you're seeing the uterus laying right posterior to the bladder usually and anterior to the rectum. And that view, when you put the probe here with the probe marker pointed towards the head, will give you essentially this view, where you will see here's uterus, and here is bladder. And then we're going to point out that right here you can see that it is a amount of anechoic fluid that isn't bounded by any obvious structure, and it's spreading through that area. So that would be suggestive of potentially free fluid from something. It can be normal, but at the same time it can be very abnormal. And just to give you an idea of where that is anatomically, you're looking and you're expecting it to be either in the vesicouterine pouch between the bladder and the uterus, or in the rectouterine pouch. It's usually easiest to see it in the vesicouterine pouch in my experience. Okay. Moving on. The one thing we're not talking about today is endocavitary or transvaginal ultrasound. Some of your instructors may be able to go over this with you depending on how much time is left to go over the various topics. It is a topic that I found generally tends to confuse a lot of folks spatially, so we're going to try to keep it to just curvilinear ultrasound for the purposes of this discussion. Okay, so let's talk through a couple of cases. So if you have a young woman who presents with severe abdominal pain, your first question is there an intrauterine pregnancy or not? So when you start off by doing this, you're going to figure out that your probe marker is oriented either to patient right or patient head. Again, you see skin and subcutaneous tissue, intra-abdominal musculature, and then you see uterus, right? That looks like a uterus. And then you see that there is a relatively hyperechoic structure there. That could be, I guess that could be endometrium, right? I see what looks like a yolk sac potentially, and then I see structure within it that looks almost like gestational sac. Now all of this would make you turn around and say that, hey, that could be an intrauterine pregnancy. And it could. The only thing that gives me pause is it's a very eccentrically located pregnancy, right? Like one would expect typically that this type of pregnancy be located more in the middle of the uterus, not really off to this edge. So that's a little concerning. And then if this is oriented correctly, this is almost off towards where the left ovary would be, or at least in the left adnexa. So this is concerning. I'm not sold that this is an intrauterine pregnancy. And then they rotate the probe towards the head and give you this nice long axis view. And this is actually the money view where you can look through and see that as you're sweeping through, there's bladder, there's uterus coming into view. We're going to track that uterus a little longer. There's this sort of odd echo texture difference between these two structures. So I'm not sure what that other structure is. And then as you come through it, the pregnancy, as it comes through, is located here, all the way at the very end of the clip, and not actually in the uterus itself. And I'll point that out one more time. And so this is the pregnancy, and we've seen that the uterus has already come and gone. So we'll do it one more time. Here's uterus, and sort of weird echo texture thing, and then there's pregnancy. So this ended up being a adnexal pregnancy that was actually live, and you could track it and see that the fetus was living, but there was causing substantial hemorrhage around it, and that was the odd-looking echo texture above it. All right, moving on to the next time we want to do this. So a young woman, let's say she's 9 or 10 years old, presents with severe excruciating abdominal pain. And you go over and you're trying to figure out, pregnancy test is negative, thankfully, and then as you're trying to figure out why she's in a ton of pain, you put a quick ultrasound probe on her belly, and you see this structure. So we'll start off by pointing out that this is bladder, right? It's an anechoic structure surrounded by a nice visible wall, and then there's this thing over here, and I'm not quite sure what that is yet. So we're going to track through it, and that looks like an ovary. It is this sort of appearance right about here, where you can see almost this chocolate chip cookie kind of appearance. You can see these number of small circular structures. That would be follicles. That's an ovary, but it's a pretty big ovary, and that's odd. We'll move on by taking another look and seeing that now when they sweep through, you can see that that's ovary and that's uterus. That first structure you see is her uterus, which is appropriately small, and then there's this very large ovary. Now that would typically make you concerned that if you see a unilateral large ovary, and you'll have to take my word that the other side, they couldn't visualize the ovary at all, that should make you very concerned that there is a high risk of there being potentially a torsion. There are advanced things you can do, looking for flow with color Doppler, putting on waveforms, measuring what the speed of blood flow is, but all of that is essentially beyond our purposes for this conversation. The next thing you can occasionally see when you go and do ultrasound, and this would typically be in a patient who is pregnant, however, is this type of view. And when you go over and you see the uterus here, and you see almost this collection of this just storm of vesicles of these circular structures. This is what a molar pregnancy looks like. And this ended up being a patient who had a partial mole, ended up having having an intrauterine fetus along with it, which becomes a lot more complicated. So this is a good reminder that you want to make sure you at least know what this kind of looks like for when you get to potentially see it. Now, I recognize that a lot of this feels sort of scary and uncomfortable given the fact that this is a very broad introduction to a very detailed topic. But as a reminder, for any point-of-care ultrasound, all you need to do is do a view of the structures you're interested in long and short axis, and that's a great start. So in this situation, you do a sweep in short axis of the uterus, a sweep in long axis of the uterus and bladder, and show me both in both axes. Then you'd move over and try to see if you could see the adnexa at all. If you can see the ovaries, that's great. If you can't, that's okay as well, as long as you've at least looked in that area to ensure that there isn't any evidence of a large mass or intraperitoneal hemorrhage or anything of that sort. So if you have any questions, here's my email, and I will look forward to seeing you guys shortly.